BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 6. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. Episodic headache with hypertension and raised urinary VMA indicates. Option A. Renal artery stenosis. Option B. Conn syndrome. Option C. Cushing syndrome. Option D. Pheochromocytoma. The correct answer is option D. Pheochromocytoma. Let's go through the options. Renal artery stenosis. Renal artery stenosis raises renin and BP but does not raise urinary VMA. Conn syndrome. Conn syndrome gives hypertension with low potassium, not raised VMA. Cushing syndrome. Cushing gives central obesity and hypertension, not episodic VMA surges. And the correct answer is pheochromocytoma. Correct episodic headache, hypertension and raised urinary VMA point to a catecholamine-secreting pheochromocytoma. So, the right answer is option D. Pheochromocytoma. Question 2. The drug used preoperatively in pheochromocytoma is Option A. Amlodipine. Option B. Propranolol. Option C. Phenoxybenzamin. Option D. Enalapril. The correct answer is option C. Phenoxybenzamin. Let's go through the options. Amlodipine. Amlodipine does not block the alpha receptors that mediate the crisis. Propranolol. Propranolol first risks unopposed alpha vasoconstriction and a hypertensive crisis. Enalapril. Enalapril does not cover the catecholamine effect. And the correct answer is phenoxybenzamin. Correct, phenoxybenzamin gives alpha blockade before surgery to prevent catecholamine surges. So, the right answer is option C. Phenoxybenzamin. Question 3. Spherocytes in the blood film are characteristically seen in Option A. Thalassemia. Option B. Iron deficiency. Option C. Autoimmune hemolytic anemia. Option D. Sideroblastic anemia. The correct answer is option C. Autoimmune hemolytic anemia. Let's go through the options. Thalassemia. Thalassemia shows target cells, not spherocytes. Iron deficiency. Iron deficiency gives hypochromic microcytic cells, not spherocytes. Sideroblastic anemia. Sideroblastic anemia shows ring sideroblasts, not spherocytes. And the correct answer is autoimmune hemolytic anemia. Correct, spherocytes are typical of autoimmune hemolytic anemia and hereditary spherocytosis. So, the right answer is option C. Autoimmune hemolytic anemia. Question 4. Craniopharyngioma is characteristically Option A. Metastatic. Option B. Highly malignant. Option C. Benign. Option D. Radioresistant only. The correct answer is option C. Benign. Let's go through the options. Metastatic. Craniopharyngioma is a primary tumor, not metastatic. Highly malignant. It is not highly malignant. Radioresistant only. It is not defined as radioresistant only. And the correct answer is benign. Correct, craniopharyngioma is a benign but locally troublesome cellular tumor. So, the right answer is option C. Benign. Question 5. The anterior pituitary secretes all of the following except Option A. Oxytocin. Option B. Growth hormone. Option C. Prolactin. Option D. Adrenocorticotropic hormone. The correct answer is option A. Oxytocin. Let's go through the options. Growth hormone. Growth hormone is an anterior pituitary hormone. Prolactin. Prolactin is an anterior pituitary hormone. Adrenocorticotropic hormone. ACT is an anterior pituitary hormone. And the correct answer is oxytocin. Correct, oxytocin is released from the posterior pituitary, so it is the exception among anterior hormones. So, the right answer is option A. Oxytocin. Question 6. Iodine not used in thyroxine synthesis is excreted mainly in the Option A. Bile. Option B. Urine. Option C. Sweat. Option D. Feces. The correct answer is option B. Urine. Let's go through the options. Bile. Bile is not the main route for surplus iodide. Sweat. Sweat loss of iodide is minor. Feces. Fecal loss is minor compared with urine. And the correct answer is urine. Correct, iodide not used in thyroxine synthesis is excreted mainly by the kidney in urine. So, the right answer is option B. Urine. Question 7. Botulinum toxin acts on the Option A. Muscle fiber. Option B. Axon terminal. Option C. Sarcolemma. Option D. Spinal cord. The correct answer is option B. Axon terminal. Let's go through the options. Muscle fiber. The toxin does not act on the muscle fiber itself. Sarcolemma. It does not act on the sarcolemma. Spinal cord. It acts peripherally, not in the spinal cord. And the correct answer is axon terminal. Correct, botulinum toxin blocks acetylcholine release at the presynaptic axon terminal. So, the right answer is option B. Axon terminal. Question 8. Atopic asthma is mediated mainly by Option A. IgM. Option B. IgA. Option C. IgE. Option D. IgG. The correct answer is option C. IgE. Let's go through the options. IgM. IgM does not mediate atopy. IgA. IgA does not mediate atopy. IgG. IgG is not the atopic antibody. And the correct answer is IgE. Correct, atopic asthma is an IgE-mediated type I hypersensitivity. So, the right answer is option C. IgE. Question 9. Meigs syndrome is characterized by an ovarian fibroma with Option A. Hepatomegaly. Option B. Lymphedema only. Option C. Ascites and pleural effusion. Option D. The correct answer is option C. Ascites and pleural effusion. Let's go through the options. Hepatomegaly. Hepatomegaly is not part of Meigs syndrome. Lymphedema only. Lymphedema alone is not the definition. Splenomegaly. Splenomegaly is not a feature. And the correct answer is ascites and pleural effusion. Correct, Meigs syndrome is ovarian fibroma with ascites and pleural effusion resolving after tumor removal. So, the right answer is option C. Ascites and pleural effusion. Question 10. Interstitial lung disease in tuberculosis is favored by all except Option A. Cirrhosis. Option B. HIV infection. Option C. Diabetes mellitus. Option D. Youth and good nutrition. The correct answer is option D. Youth and good nutrition. Let's go through the options. Cirrhosis. Cirrhosis impairs immunity and favors TB. HIV infection. HIV strongly predisposes to TB. Diabetes mellitus. Diabetes predisposes to TB. And the correct answer is youth and good nutrition. Correct. Youth with good nutrition protects against TB, so it is the exception. So, the right answer is option D. Youth and good nutrition. Question 11. Postoperative hypotension is most commonly caused by Option A. Pain. Option B. Hypothermia. Option C. Sepsis. Option D. Anxiety. The correct answer is option C. Sepsis. Let's go through the options. Pain. Pain raises rather than lowers blood pressure. Hypothermia. Hypothermia contributes but is not the commonest cause. Anxiety. Anxiety does not typically cause hypotension. And the correct answer is sepsis. Correct. Sepsis is the commonest cause of postoperative hypotension through vasodilatation. So, the right answer is option C. Sepsis. Question 12. The commonest cause of anosmia with preserved perception of ammonia is Option A. Sinusitis. Option B. Nasal polyp. Option C. Olfactory nerve damage with intact trigeminal fibers. Option D. Deviated septum. The correct answer is option C. Olfactory nerve damage with intact trigeminal fibers. Let's go through the options. Sinusitis. Sinusitis causes conductive nasal blockage, not selective loss of smell with intact ammonia sense. Nasal polyp. A polyp obstructs airflow rather than damaging the olfactory nerve selectively. Deviated septum. A deviated septum causes obstruction, not selective anosmia. And the correct answer is olfactory nerve damage with intact trigeminal fibers. Correct. Olfactory nerve damage abolishes true smell while trigeminal fibers still sense pungent ammonia. So, the right answer is option C. Olfactory nerve damage with intact trigeminal fibers. Question 13. Digitalis toxicity is not precipitated by Option A. Hypercalcemia. Option B. Hypokalemia. Option C. Chronic obstructive pulmonary disease. Option D. Renal impairment. The correct answer is option C. Chronic obstructive pulmonary disease. Let's go through the options. Hypercalcemia. Hypercalcemia potentiates digitalis toxicity. Hypokalemia. Hypokalemia potentiates digitalis toxicity. Renal impairment. And the correct answer is chronic obstructive pulmonary disease. Correct. COPT is not a recognized precipitant of digitalis toxicity. So, the right answer is option C. Chronic obstructive pulmonary disease. Question 14. In sickle cell disease with acute dyspnea and pleuritic pain, the first step is Option A. Oxygen therapy. Option B. Immediate exchange transfusion. Option C. Thrombolysis. Option D. Chest drain. The correct answer is option A, oxygen therapy. Let's go through the options. Immediate exchange transfusion. Exchange transfusion is used for severe or worsening cases, not the very first step. Thrombolysis. Thrombolysis is not the treatment. Chest drain. A chest drain is not indicated for acute chest syndrome. And the correct answer is oxygen therapy. Correct. In acute chest syndrome, the immediate first step is oxygen with fluids and analgesia. So, the right answer is option A. Oxygen therapy. Question 15. Aplastic anemia is a recognized late complication of option A, splenectomy. Option B, gastrectomy. Option C, appendicectomy. Option D, cholecystectomy. The correct answer is option B, gastrectomy. Let's go through the options. Splenectomy. Splenectomy is not a recognized cause of aplastic anemia. Appendicectomy. Appendicectomy does not cause aplastic anemia. Cholecystectomy. Cholecystectomy does not cause aplastic anemia. Answer key debatable, flagged for review. And the correct answer is gastrectomy. Correct. Gastrectomy is associated with later marrow failure states in this exam key. So, question 16. Giant cell arteritis with visual loss is treated with option A, oral aspirin alone. Option B, high-dose intravenous steroids. Option C, antibiotics. Option D, observation. The correct answer is option B, high-dose intravenous steroids. Let's go through the options. Oral aspirin alone. Aspirin alone does not protect the eye in giant cell arteritis. Antibiotics. It is not a bacterial infection. Observation. Observation risks blindness. And the correct answer is high-dose intravenous steroids. Correct. Visual loss in giant cell arteritis needs urgent high-dose 4 steroids to save the other eye. So, the right answer is option B. High-dose intravenous steroids. Question 17. Hypertensive encephalopathy characteristically produces option A, seizures and altered consciousness. Option B, isolated headache. Option C, fever. Option D, chest pain. The correct answer is option A, seizures and altered consciousness. Let's go through the options. Isolated headache. Isolated headache understates the picture. Fever. Fever is not the defining feature. Chest pain. Chest pain is not the defining feature. And the correct answer is seizures and altered consciousness. Correct. Hypertensive encephalopathy causes seizures and altered consciousness from cerebral edema. So, the right answer is option A. Seizures and altered consciousness. Question 18. MRI is superior to CT scan in all of the following except option A, subarachnoid hemorrhage. Option B, posterior fossa lesions. Option C, spinal cord lesions. Option D, soft tissue tumors. The correct answer is option A, subarachnoid hemorrhage. Let's go through the options. Posterior fossa lesions. MRI is superior for posterior fossa lesions. Spinal cord lesions. MRI is superior for spinal cord lesions. Soft tissue tumors. MRI is superior for soft tissue tumors. And the correct answer is subarachnoid hemorrhage. Correct, CT is better than MRI for acute subarachnoid hemorrhage, so this is the exception. So, the right answer is option A. Subarachnoid hemorrhage. Question 19. Cryptosporidiosis in an immunocompromised patient is diagnosed by option A. Serology, option B. Blood culture, option C. Duodenal aspirate only, option D. Stool examination. The correct answer is option D. Stool examination. Let's go through the options. Serology. Serology is not the diagnostic test for cryptosporidium. Blood culture. Blood culture does not detect it. Duodenal aspirate only. Duodenal aspirate alone is not standard. And the correct answer is stool examination. Correct, cryptosporidiosis is diagnosed by acid-fast stool examination for oocysts. So, the right answer is option D. Stool examination. Question 20. Chagas disease is best described as option A. An uncommon disease in this region. Option B. The commonest tropical infection. Option C. A bacterial infection. Option D. A viral infection. The correct answer is option A. An uncommon disease in this region. Let's go through the options. The common, a bacterial infection. It is protozoal, not bacterial. A viral infection. It is protozoal, not viral. And the correct answer is an uncommon disease in this region. Correct, Chagas disease is an American trypanosmiasis, uncommon in this region. So, the right answer is option A. An uncommon disease in this region. Question 21. A brachial cyst characteristically swells on option A. Swallowing, option B. Valsalva maneuver, option C. Coughing only, option D. Neck flexion. The correct answer is option B. Valsalva maneuver. Let's go through the options. Swallowing. A branchial cyst does not move with swallowing. Coughing only. Coughing alone is not the characteristic sign. Neck flexion. Neck flexion is not the sign. Classic feature is a painless lateral neck cyst item flagged. And the right answer is option B. Valsalva maneuver. Question 22. Non-union is a recognized complication of fracture of the option A. Humeral shaft, option B. Femoral shaft, option C. Mid-shaft of clavicle, option D. Tibial plateau. The correct answer is option C. Mid-shaft of clavicle. Let's go through the options. Humeral shaft. Humeral shaft usually unites with conservative care. Femoral shaft. Femoral shaft generally unites after fixation. Tibial plateau. Tibial plateau non-union is less characteristic than clavicle. And the correct answer is mid-shaft of clavicle. Correct, the mid-shaft clavicle is a recognized site of non-union. So, the right answer is option C. Mid-shaft of clavicle. Question 23. Fracture of the mid-shaft of the clavicle is best treated by option A. External fixation, option B. Open reduction, option C. Broad arm sling and analgesia, option D. Traction. The correct answer is option C. Broad arm sling and analgesia. Let's go through the options. External fixation. External fixation is not needed for a simple clavicle fracture. Open reduction. Open reduction is reserved for specific indications. Traction. Traction is not used. And the correct answer is broad arm sling and analgesia. Correct. Most midshaft clavicle fractures heal with a broad arm sling and analgesia. So, the right answer is option C. Broad arm sling and analgesia. Question 24. Melon seed bodies are characteristically found in A. Option A. Bursa of the knee. Option B. Baker cyst. Option C. Compound palmar ganglion. Option D. Ganglion of the wrist. The correct answer is option C. Compound palmar ganglion. Let's go through the options. Bursa of the knee. The knee bursa is not the classic site. Baker cyst. A Baker cyst does not contain melon seed bodies. Ganglion of the wrist. A simple wrist ganglion does not contain them. And the correct answer is compound palmar ganglion. Correct. Melon seed, rice, bodies are typical of a tuberculous compound palmar ganglion. So, the right answer is option C. Compound palmar ganglion. Question 25. An unstable hip detected at birth is managed by keeping the joint in. Option A. Full extension. Option B. 90 degrees flexion and abduction. Option C. Adduction. Option D. Internal rotation. The correct answer is option B. 90 degrees flexion and abduction. Let's go through the options. Full extension. Full extension worsens hip instability. Adduction. Adduction dislocates the hip. Internal rotation. Internal rotation is not the treatment position. And the correct answer is 90 degrees flexion and abduction. Correct. Developmental hip instability is held reduced in flexion and abduction, Pavlik von Rosen position. So, the right answer is option B. 90 degrees flexion and abduction. Question 26. Intermuscular bleeding after a direct blow characteristically produces. Option A. Immediate local swelling only. Option B. Distant bruising along the line of gravity. Option C. No bruising. Option D. Compartment syndrome always. The correct answer is option B. Distant bruising along the line of gravity. Let's go through the options. Immediate local swelling only. Immediate local swelling only understates deep intermuscular bleeding. No bruising. There is bruising appearing away from the site. Compartment syndrome always. Compartment syndrome is the intramuscular pattern, not always intermuscular. And the correct answer is distant bruising along the line of gravity. Correct. Intermuscular bleeding tracks down and shows distant bruising along the line of gravity. So, the right answer is option B. Distant bruising along the line of gravity. Question 27. The best diagnostic test for shoulder pain is Option A. X-ray. Option B. Ultrasound. Option C. CT scan. Option D. Bone scan. The correct answer is option A. X-ray. Let's go through the options. Ultrasound. Ultrasound is useful for cuff tears but is not the first test here. CT scan. CT is not first line. Bone scan. Bone scan is not first line. Key debatable, ultrasound MRI often preferred, flagged. And the correct answer is X-ray. Correct, plain X-ray is the first-line investigation for shoulder pain in this key. So, the right answer is option A. X-ray. Question 28. The next step in the management of disc herniation without neurological deficit is option A. Immediate surgery. Option B. NSAIDs and mobilization. Option C. Bed rest for 6 weeks. Option D. Traction. The correct answer is option B. NSAIDs and mobilization. Let's go through the options. Immediate surgery. Immediate surgery is not indicated without a deficit. Bed rest for 6 weeks. Prolonged bed rest is discouraged. Traction. Traction is not standard. And the correct answer is NSAIDs and mobilization. Correct, disc herniation without neurological deficit is managed with NSAIDs and early mobilization. So, the right answer is option B. NSAIDs and mobilization. Question 29. A pulsating varicose vein suggests an underlying. Option A. Lymphatic obstruction. Option B. Deep vein thrombosis. Option C. Arteriovenous fistula. Option D. Venous ulcer. The correct answer is option C. Arteriovenous fistula. Let's go through the options. Lymphatic obstruction. Lymphatic obstruction does not make a vein pulsate. Deep vein thrombosis. DVT does not cause a pulsating varicosity. Venous ulcer. A venous ulcer does not pulsate. And the correct answer is arteriovenous fistula. Correct, a pulsating varicose vein suggests an underlying arteriovenous fistula. So, the right answer is option C. Arteriovenous fistula. Question 30. An electrical burn characteristically causes. Option A. Hypocalcemia only. Option B. Hypernatremia. Option C. Acute kidney injury with myoglobinuria. Option D. Respiratory alkalosis. The correct answer is option C. Acute kidney injury with myoglobinuria. Let's go through the options. Hypocalcemia only. Hypocalcemia alone is not the main danger. Hypernatremia. Hypernatremia is not the characteristic result. Respiratory alkalosis. Respiratory alkalosis is not the feature. And the correct answer is acute kidney injury with myoglobinuria. Correct, deep muscle damage in electrical burns causes myoglobinuria and acute kidney injury. So, the right answer is option C. Acute kidney injury with myoglobinuria. Question 31. Contusion is defined as injury. Option A. With bone fracture. Option B. With a skin tear. Option C. Without a tear in the skin. Option D. With nerve division. The correct answer is option C. Without a tear in the skin. Let's go through the options. With bone fracture. A contusion is not defined by a fracture. With a skin tear. A skin tear makes it a laceration, not a contusion. With nerve division. Nerve division is not part of the definition. And the correct answer is without a tear in the skin. Correct, a contusion is a bruise, injury without a break in the skin. So, the right answer is option C. Without a tear in the skin. Question 32. In treating phosphorus burns, the agent used is Option A. Normal saline only. Option B. Copper sulfate with bicarbonate. Option C. Alcohol. Option D. Iodine. The correct answer is option B. Copper sulfate with bicarbonate. Let's go through the options. Normal saline only. Saline alone does not neutralize phosphorus. Alcohol. Alcohol is not used. Iodine. Iodine is not the treatment. And the correct answer is copper sulfate with bicarbonate. Correct. Phosphorus burns are treated with copper sulfate to mark particles and bicarbonate irrigation. So, the right answer is option B. Copper sulfate with bicarbonate. Question 33. The android pelvis is characterized by a prominent. Option A. Sacral promontory only. Option B. Ischial spine. Option C. Wide subpubic arch. Option D. Round inlet. The correct answer is option B. Ischial spine. Let's go through the options. Sacral promontory only. A prominent promontory alone does not define android. Wide subpubic arch. A wide subpubic arch is a gynaecoid feature. Round inlet. A round inlet is gynaecoid, not android. And the correct answer is ischial spine. Correct. The android, male type, pelvis has prominent ischial spines and a narrow forepelvis. So, the right answer is option B. Ischial spine. Question 34. Primary dysmenorrhea is characterized by Option A. Endometriosis. Option B. No demonstrable pelvic pathology. Option C. Fibroids. Option D. Pelvic infection. The correct answer is option B. No demonstrable pelvic pathology. Let's go through the options. Endometriosis. Endometriosis causes secondary, not primary, dysmenorrhea. Fibroids. Fibroids cause secondary dysmenorrhea. Pelvic infection. Pelvic infection causes secondary dysmenorrhea. And the correct answer is no demonstrable pelvic pathology. Correct. Primary dysmenorrhea has no demonstrable pelvic pathology. So, the right answer is option B. No demonstrable pelvic pathology. Question 35. Habitual abortion is most commonly associated with Option A. Cervical incompetence. Option B. Fibroid. Option C. Anemia. Option D. Hypertension. The correct answer is option A. Cervical incompetence. Let's go through the options. Fibroid. Fibroids are a less consistent cause. Anemia. Anemia is not a direct cause. Hypertension. Hypertension is not the usual cause of habitual abortion. And the correct answer is cervical incompetence. Correct. Cervical incompetence is the classic cause of recurrent, habitual mid-trimester abortion. So, the right answer is option A. Cervical incompetence. Question 36. Fetal electronic monitoring is characterized by Option A. Perfect accuracy. Option B. High specificity with low sensitivity. Option C. Both low. Option D. High sensitivity with low specificity. The correct answer is option D. High sensitivity with low specificity. Let's go through the options. Perfect accuracy. It is not perfectly accurate. High specificity with low sensitivity? It is not high specificity with low sensitivity. Both low. Both being low is incorrect. And the correct answer is high sensitivity with low specificity. Correct. Electronic fetal monitoring has high sensitivity but low specificity, so it overcalls distress. So, the right answer is option D. High sensitivity with low specificity. Question 37. Shoulder dystocia is most closely associated with option A. Preterm labor. Option B. Obstructed labor. Option C. Placenta previa. Option D. Polyhydramnios only. The correct answer is option B. Obstructed labor. Let's go through the options. Preterm labor. Preterm labor is not the main association. Placenta previa. Placenta previa is unrelated. Polyhydramnios only. Polyhydramnios alone is not the closest link. And the correct answer is obstructed labor. Correct. Shoulder dystocia arises in obstructed labor, classically with a large baby. So, the right answer is option B. Obstructed labor. Question 38. An unstable lie of the fetus is most commonly caused by option A. Fundal fibroid. Option B. Oligohydramnios. Option C. Cephalopelvic disproportion. Option D. Post-maturity. The correct answer is option A. Fundal fibroid. Let's go through the options. Oligohydramnios. Oligohydramnios fixes the lie rather than making it unstable. Cephalopelvic disproportion. CPD affects engagement more than lie stability. Post-maturity. Post-maturity is not the usual cause. And the correct answer is fundal fibroid. Correct. A fundal fibroid prevents the head engaging and causes an unstable lie. So, the right answer is option A. Fundal fibroid. Question 39. Which is protective against carcinoma of the breast? Option A. Multiparity. Option B. Early menarche. Option C. Late menopause. Option D. Nulliparity. The correct answer is option A. Multiparity. Let's go through the options. Early menarche. Early menarche raises risk. Late menopause. Late menopause raises risk. Nulliparity. Nulliparity raises risk. And the correct answer is multiparity. Correct. Multiparity and early first pregnancy is protective against breast cancer. So, the right answer is option A. Multiparity. Question 40. Chorioamnionitis is a recognized cause of option A. Ectopic pregnancy. Option B. Placenta previa. Option C. Molar pregnancy. Option D. Placental abruption. The correct answer is option D. Placental abruption. Let's go through the options. Ectopic pregnancy. Chorioamnionitis does not cause ectopic pregnancy. Placenta previa. It is not a cause of placenta previa. Molar pregnancy. It does not cause molar pregnancy. And the correct answer is placental abruption. Correct. Intrauterine infection is a recognized cause of placental abruption. So, the right answer is option D. Placental abruption. Question 41. In aseptic abortion, which is not appropriate management? Option A. Resuscitation. Option B. Intravenous antibiotics. Option C. Evacuation. Option D. Outpatient tetracycline. The correct answer is option D. Outpatient tetracycline. Let's go through the options. Resuscitation. Resuscitation is appropriate in septic abortion. Intravenous antibiotics. 4 antibiotics are appropriate. Evacuation. Evacuation of infected products is appropriate. And the correct answer is outpatient tetracycline. Correct. Outpatient oral tetracycline is not adequate management of septic abortion. So, the right answer is option D. Outpatient tetracycline. Question 42. Moderate dyskaryosis on cervical smear requires. Option A. Hysterectomy. Option B. Repeat smear in 3 years. Option C. Colposcopy. Option D. Observation. The correct answer is option C. Colposcopy. Let's go through the options. Hysterectomy. Hysterectomy is not the response to moderate dyskaryosis. Repeat smear in 3 years. Delaying to a 3-year repeat is unsafe for moderate changes. Observation. Observation alone is inadequate. And the correct answer is colposcopy. Correct. Moderate dyskaryosis needs colposcopy for assessment. So, the right answer is option C. Colposcopy. Question 43. Coitus in adolescence is a recognized risk factor for. Option A. Carcinoma ovary. Option B. Carcinoma endometrium. Option C. Carcinoma cervix. Option D. Carcinoma vulva. The correct answer is option C. Carcinoma cervix. Let's go through the options. Carcinoma ovary. Early coitus is not the key risk for ovarian cancer. Carcinoma endometrium. It is not the key risk for endometrial cancer. Carcinoma vulva. It is not the main risk for vulval cancer. And the correct answer is carcinoma cervix. Correct. Early sexual activity, HPV exposure, is a risk factor for cervical carcinoma. So, the right answer is option C. Carcinoma cervix. Question 44. Which is not a feature of carcinoma of the breast on examination? Option A. Skin tethering. Option B. A well-defined mobile mass. Option C. Nipple retraction. Option D. Body orange. The correct answer is option B. A well-defined mobile mass. Let's go through the options. Skin tethering. Skin tethering is a feature of breast cancer. Nipple retraction. Nipple retraction is a cancer feature. Body orange. Body orange is a cancer feature. And the correct answer is a well-defined mobile mass. Correct. A well-defined mobile mass suggests a benign lesion, so it is not a cancer feature. So, the right answer is option B. A well-defined mobile mass. Question 45. Head circumference at birth is 35 centimeters. It reaches 43 centimeters at about. Option A. 4 months. Option B. 2 months. Option C. 8 months. Option D. 12 months. The correct answer is option A. 4 months. Let's go through the options. 2 months. 2 months is too early for that gain. 8 months. 8 months overshoots the milestone. 12 months. 12 months is too late for 43 centimeters. And the correct answer is 4 months. Correct head circumference rises from about 35 centimeters to 43 centimeters by roughly 4 months. So, the right answer is option A. 4 months. Question 46. A child sits without support at about. Option A, 6 months. Option B, 3 months. Option C, 9 months. Option D, 12 months. The correct answer is option A, 6 months. Let's go through the options. 3 months. 3 months is too early. 9 months. 9 months is later than the milestone. 12 months. 12 months is walking age. And the correct answer is 6 months. Correct, a baby sits without support at about 6 months. So, the right answer is option A. 6 months. Question 47. The earliest sign of rickets to appear is option A, Harrison sulcus. Option B, bowing of legs. Option C, rickety rosary. Option D, craniotapes. The correct answer is option D, craniotapes. Let's go through the options. Harrison sulcus. Harrison sulcus appears later. Bowing of legs. Bowing of the legs is a later, weight-bearing sign. Rickety rosary. The rickety rosary appears later. And the correct answer is craniotapes. Correct, craniotapes, soft skull, is the earliest sign of rickets. So, the right answer is option D. Craniotapes. Question 48. The prenatal period is defined as up to option A, 22 weeks of gestation. Option B, 12 weeks. Option C, 28 weeks. Option D, birth. The correct answer is option A, 22 weeks of gestation. Let's go through the options. 12 weeks. 12 weeks is the end of the first trimester, not the definition used. 28 weeks. 28 weeks is the perinatal boundary, not prenatal here. Birth. Birth marks the end of the whole antenatal period, not the term used. And the correct answer is 22 weeks of gestation. Correct, in this key the prenatal period is taken up to about 22 weeks of gestation. So, the right answer is option A. 22 weeks of gestation. Question 49. Treatment of hypertrophic pyloric stenosis in a neglected late case may require option A, fundoplication. Option B, gastroenterostomy. Option C, gastrectomy. Option D, vagotomy. The correct answer is option B, gastroenterostomy. Let's go through the options. Fundoplication. Fundoplication treats reflux, not pyloric stenosis. Gastrectomy. Gastrectomy is excessive. Vagotomy. Vagotomy is not the treatment. And the correct answer is gastroenterostomy. Correct, a neglected late pyloric stenosis with a scarred pylorus may need a bypass gastroenterostomy. So, the right answer is option B. Gastroenterostomy. Question 50. A 2 cm umbilical hernia in a 2-year-old is managed by option A, aspiration. Option B, immediate mesh repair. Option C, strapping. Option D, observation with later repair if persistent. The correct answer is option D, observation with later repair if persistent. Let's go through the options. Aspiration. Aspiration does not treat a hernia. Immediate mesh repair. Immediate mesh repair is inappropriate in a toddler. Strapping. Strapping does not cure it. And the correct answer is observation with later repair if persistent. Correct. Small umbilical hernias in young children are watched and repaired only if they persist past about 4 years. So, the right answer is option D. Observation with later repair if persistent. Question 51. Severe pneumonia in a child with upper respiratory infection is suggested by option A, fever alone. Option B, subcostal recession. Option C, cough alone. Option D, rhinorrhea. The correct answer is option B, subcostal recession. Let's go through the options. Fever alone. Fever alone does not define severe pneumonia. Cough alone. Cough alone is non-specific. Rhinorrhea. Rhinorrhea suggests simple urti, not severe pneumonia. And the correct answer is subcostal recession. Correct. Lower chest wall, subcostal recession is the WHO sign of severe pneumonia. So, the right answer is option B. Subcostal recession. Question 52. The Moro reflex is characteristically absent in option A, breastfed infants. Option B, normal newborns. Option C, preterm infants only. Option D, cerebral irritability. The correct answer is option D, cerebral irritability. Let's go through the options. Breastfed infants. Breastfeeding does not abolish the Moro reflex. Normal newborns. It is present in normal newborns. Preterm infants only. It is present, though weaker, in preterm infants. And the correct answer is cerebral irritability. Correct. The Moro reflex is absent or asymmetrical with cerebral irritability or injury. So, the right answer is option D. Cerebral irritability. Question 53. Congenital rubella syndrome includes all except option A, cardiac defect. Option B, cataract. Option C, deafness. Option D, epicanthic folds. The correct answer is option D, epicanthic folds. Let's go through the options. Cardiac defect. Cardiac defects occur in congenital rubella. Cataract. Cataracts occur in congenital rubella. Deafness. Deafness occurs in congenital rubella. And the correct answer is epicanthic folds. Correct. Epicanthic folds belong to Down syndrome, not congenital rubella. So, the right answer is option D. Epicanthic folds. Question 54. The inner ear has option A, drainage to cervical nodes. Option B, drainage to parotid nodes. Option C, no lymphatic drainage. Option D, drainage to retropharyngeal nodes. The correct answer is option C, no lymphatic drainage. Let's go through the options. Drainage to cervical nodes. The inner ear does not drain to cervical nodes. Drainage to parotid nodes. It does not drain to parotid nodes. Drainage to retropharyngeal nodes. It does not drain to retropharyngeal nodes. And the correct answer is no lymphatic drainage. Correct. The inner ear, labyrinth, has no lymphatic drainage. So, the right answer is option C. No lymphatic drainage. Question 55. Malignant pleomorphic adenoma most commonly arises in the option A. Sublingual gland, option B. Submandibular gland, option C. Parotid gland, option D. Minor salivary glands. The correct answer is option C. Parotid gland. Let's go through the options. Sublingual gland. The sublingual gland is not the usual site. Submandibular gland. The submandibular gland is a less common site. Minor salivary glands. Minor salivary glands are a less common site. And the correct answer is parotid gland. Correct. Pleomorphic adenoma and its malignant change most often arise in the parotid gland. So, the right answer is option C. Parotid gland. Question 56. Chorda tympani carries taste from the option A. Palate, option B. Posterior third, option C. Whole tongue, option D. Anterior 2/3 of the tongue. The correct answer is option D. Anterior 2/3 of the tongue. Let's go through the options. Palate. The palate is supplied by the greater palatine lesser palatine nerves, not chorda tympani. Posterior third. The posterior third is supplied by the glossopharyngeal nerve. Whole tongue. It does not carry taste from the whole tongue. And the correct answer is anterior 2/3 of the tongue. Correct. The chorda tympani carries taste from the anterior 2/3 of the tongue. So, the right answer is option D. Anterior 2/3 of the tongue. Question 57. Radical antrostomy refers to option A. Mastoidectomy, option B. Intranasal antrostomy, option C. Tonsillectomy, option D. Septoplasty. The correct answer is option B. Intranasal antrostomy. Let's go through the options. Mastoidectomy. Mastoidectomy is an ear operation, not an antrostomy. Tonsillectomy. Tonsillectomy is unrelated. Septoplasty. Septoplasty is unrelated. And the correct answer is intranasal antrostomy. Correct. Radical antrostomy is an intranasal opening into the maxillary antrum. So, the right answer is option B. Intranasal antrostomy. Question 58. Bullous meningitis is characteristically option A. Serous, option B. Purulent, option C. Hemorrhagic, option D. Fungal. The correct answer is option C. Hemorrhagic. Let's go through the options. Serous. Bullous meningitis is not simply serous. Purulent. It is not primarily purulent. Fungal. It is not a fungal condition. And the correct answer is hemorrhagic. Correct. Bullous meningitis produces hemorrhagic blisters on the drum. So, the right answer is option C. Hemorrhagic. Question 59. Ear wax is softened using option A. Normal saline, option B. 2% sodium bicarbonate in glycerin, option C. Alcohol, option D. Hydrogen peroxide only. The correct answer is option B. 2% sodium bicarbonate in glycerin. Let's go through the options. Normal saline. Plain saline is a poor wax softener. Alcohol. Alcohol dries rather than softens wax. Hydrogen peroxide only. Hydrogen peroxide alone is not the standard softener. And the correct answer is 2% sodium bicarbonate in glycerin. Correct, sodium bicarbonate, 2%, in glycerin softens ear wax before syringing. So, the right answer is option B. 2% sodium bicarbonate in glycerin. Question 60. Tubotympanic type of CSOM is characterized by discharge that is: Option A, odorless and profuse. Option B, foul-smelling and scanty. Option C, blood-stained. Option D, absent. The correct answer is option A, odorless and profuse. Let's go through the options. Foul-smelling and scanty. Foul-smelling scanty discharge suggests the unsafe atticoantral type. Blood-stained. Blood-stained discharge suggests other pathology. Absent. Discharge is present, not absent. And the correct answer is odorless and profuse. Correct, tubotympanic, safe, CSOM gives odorless, profuse, mucoid discharge. So, the right answer is option A. Odorless and profuse. Question 61. A laryngocele herniates through the: Option A, cricothyroid membrane. Option B, thyrohyoid membrane. Option C, cricoid cartilage. Option D, thyroid cartilage. The correct answer is option B, thyrohyoid membrane. Let's go through the options. Cricothyroid membrane. The laryngocele does not herniate through the cricothyroid membrane. Cricoid cartilage. It does not pass through the cricoid cartilage. Thyroid cartilage. It does not pass through the thyroid cartilage. And the correct answer is thyrohyoid membrane. Correct, a laryngocele herniates through the thyrohyoid membrane where the superior laryngeal vessel spears it. So, the right answer is option B. Thyrohyoid membrane. Question 62. Androphonia is corrected by: Option A, type 4 thyroplasty. Option B, type 1 thyroplasty. Option C, chordectomy. Option D, tracheostomy. The correct answer is option A, type 4 thyroplasty. Let's go through the options. Type 1 thyroplasty. Type 1 thyroplasty medializes a paralyzed cord, it does not raise pitch. Chordectomy. Chordectomy removes a cord and is not for pitch change. Tracheostomy. Tracheostomy does not correct voice pitch. And the correct answer is type 4 thyroplasty. Correct, androphonia, abnormally low male type voice, is corrected by type 4 cricothyroid approximation, thyroplasty to raise pitch. So, the right answer is option A. Type 4 thyroplasty. Question 63. Which drug class causes hearing loss? Option A, penicillins. Option B, aminoglycosides. Option C, macrolides only. Option D, cephalosporins. The correct answer is option B, aminoglycosides. Let's go through the options. Penicillins. Penicillins are not typically ototoxic. Macrolides only. Macrolides are only rarely ototoxic. Cephalosporins. Cephalosporins are not classically ototoxic. And the correct answer is aminoglycosides. Correct, aminoglycosides, e.g. gentamicin, are classically ototoxic. So, the right answer is option B. Aminoglycosides. Question 64. Triple therapy for Helicobacter pylori consists of Option A. Bismuth alone. Option B. 2 antibiotics only. Option C. APPI alone. Option D. A proton pump inhibitor with amoxicillin and clarithromycin. The correct answer is option D. A proton pump inhibitor with amoxicillin and clarithromycin. Let's go through the options. Bismuth alone. Bismuth alone is not triple therapy. 2 antibiotics only. 2 antibiotics without an acid suppressant is not standard triple therapy. APPI alone. A PPI alone is not eradication therapy. And the correct answer is a proton pump inhibitor with amoxicillin and clarithromycin. Correct H. pylori triple therapy is a PPI plus amoxicillin and clarithromycin. So, the right answer is option D. A proton pump inhibitor with amoxicillin and clarithromycin. Question 65. In gastric dyspepsia with diabetes mellitus, the drug given is Option A. Antacid. Option B. Ranitidine. Option C. Sucralfate. Option D. Metoclopramide. The correct answer is option D. Metoclopramide. Let's go through the options. Antacid. An antacid does not address gastroparesis. Ranitidine. Ranitidine reduces acid but not gastric emptying. Sucralfate. Sucralfate coats but does not promote emptying. And the correct answer is metoclopramide. Correct metoclopramide is a prokinetic that helps diabetic gastroparesis-related dyspepsia. So, the right answer is option D. Metoclopramide. Question 66. Diabetic nephropathy is best treated with Option A. A calcium channel blocker. Option B. An ACE inhibitor. Option C. A thiazide. Option D. A beta blocker. The correct answer is option B. An ACE inhibitor. Let's go through the options. A calcium channel blocker. A calcium channel blocker does not give the renal protection of ACE inhibitors. A thiazide. A thiazide is not renoprotective in this setting. A beta blocker. A beta blocker is not the treatment of choice. And the correct answer is an ACE inhibitor. Correct ACE inhibitors are first line for diabetic nephropathy, reducing proteinuria. So, the right answer is option B. An ACE inhibitor. Question 67. Atropine should not be given in Option A. Primary open-angle glaucoma. Option B. Bradycardia. Option C. Organophosphate poisoning. Option D. Bowel colic. The correct answer is option A. Primary open-angle glaucoma. Let's go through the options. Bradycardia. Atropine is used for bradycardia. Organophosphate poisoning. Atropine is used in organophosphate poisoning. Bowel colic. Atropine relieves bowel colic, antispasmodic. And the correct answer is primary open-angle glaucoma. Correct atropine dilates the pupil and can precipitate angle closure, so it is avoided in glaucoma. So, the right answer is option A. Primary open-angle glaucoma. Question 68. Acute iridocyclitis is treated with Option A. Acetazolamide. Option B. Pilocarpine. Option C. Timolol. Option D. Atropine. The correct answer is option D. Atropine. Let's go through the options. Acetazolamide. Acetazolamide lowers pressure but does not rest the iris. Pilocarpine. Pilocarpine constricts the pupil and worsens iritis. Timolol. Timolol is for glaucoma, not iritis. And the correct answer is atropine. Correct. Atropine dilates and rests the inflamed iris, preventing synechia in iridocyclitis. So, the right answer is option D. Atropine. Question 69. Amoxicillin with clavulanic acid is used in option A. Parasitic infection. Option B. Viral infection. Option C. Fungal infection. Option D. Penetrating injury. The correct answer is option D. Penetrating injury. Let's go through the options. Parasitic infection. Coamoxiclav does not treat parasites. Viral infection. It does not treat viral infection. Fungal infection. It does not treat fungal infection. And the correct answer is penetrating injury. Correct. Amoxicillin clavulanate covers the mixed flora of contaminated penetrating wounds. So, the right answer is option D. Penetrating injury. Question 70. Antibiotic prophylaxis for a surgical procedure uses amoxicillin how long before? Option A. Immediately after. Option B. 12 hours. Option C. 24 hours. Option D. 2 hours. The correct answer is option D. 2 hours. Let's go through the options. Immediately after. Giving it after the procedure misses prophylaxis. 12 hours. 12 hours before is too early. 24 hours. 24 hours before is too early. And the correct answer is 2 hours. Correct. Surgical amoxicillin prophylaxis is given about 2 hours within one dose before the procedure. So, the right answer is option D. 2 hours. Question 71. In the treatment of COPD, which is not used? Option A. Prednisolone. Option B. Ipratropium. Option C. Salbutamol. Option D. Beta-adrenergic blockers. The correct answer is option D. Beta-adrenergic blockers. Let's go through the options. Prednisolone. Prednisolone is used in COPD exacerbations. Ipratropium. Ipratropium is a mainstay bronchodilator in COPD. Salbutamol. Salbutamol is used in COPD. And the correct answer is beta-adrenergic blockers. Correct. Beta-adrenergic blockers are avoided as they cause bronchospasm. So, the right answer is option D. Beta-adrenergic blockers. Question 72. Dryness of the eye does not occur in option A. Sjogren syndrome. Option B. Trachoma. Option C. Vitamin A deficiency. Option D. Stevens-Johnson syndrome. The correct answer is option B. Trachoma. Let's go through the options. Sjogren syndrome. Sjogren syndrome causes dry eyes. Vitamin A deficiency. Vitamin A deficiency causes xerophthalmia, dry eye. Stevens-Johnson syndrome. Stevens-Johnson syndrome scars the conjunctiva and causes dryness. And the correct answer is trachoma. Correct. Trachoma classically causes a wet, discharging eye, so dryness does not typically occur, late scarring aside. So, the right answer is option B. Trachoma. Question 73. Exophthalmos is caused by all except option A. Arteriovenous malformation, option B. Thyroid disease, option C. Orbital tumor, option D. Orbital cellulitis. The correct answer is option A. Arteriovenous malformation. Let's go through the options. Thyroid disease. Thyroid eye disease causes exophthalmos. Orbital tumor. An orbital tumor causes proptosis. Orbital cellulitis. Orbital cellulitis causes proptosis. And the correct answer is arteriovenous malformation. Correct. An intracranial of malformation is not a typical cause of proptosis, so it is the exception. So, the right answer is option A. Arteriovenous malformation. Question 74. A dilated pupil is seen in all except option A. Head injury, option B. Third nerve palsy, option C. Atropine instillation, option D. Pontine hemorrhage. The correct answer is option D. Pontine hemorrhage. Let's go through the options. Head injury. Head injury can cause a fixed dilated pupil. Third nerve palsy. Third nerve palsy dilates the pupil. Atropine instillation. Atropine dilates the pupil. And the correct answer is pontine hemorrhage. Correct. Pontine hemorrhage causes pinpoint, constricted pupils, so it is the exception. So, the right answer is option D. Pontine hemorrhage. Question 75. Visual acuity is grossly reduced in option A. Simple myopia, option B. Early papilledema, option C. Papilledema with optic atrophy, option D. Astigmatism. The correct answer is option C. Papilledema with optic atrophy. Let's go through the options. Simple myopia. Simple myopia is correctable and acuity is not grossly reduced. Early papilledema. Early papilledema spares central acuity. Astigmatism. Astigmatism is refractive and correctable. And the correct answer is papilledema with optic atrophy. Correct. Papilledema that has progressed to optic atrophy grossly reduces visual acuity. So, the right answer is option C. Papilledema with optic atrophy. Question 76. Photophthalmia is managed by option A. Surgery, option B. Steroid drops, option C. Antibiotics, option D. Reassurance and eye bathing. The correct answer is option D. Reassurance and eye bathing. Let's go through the options. Surgery. Surgery is not needed for photophthalmia, uveic keratitis. Steroid drops. Steroids are not first line for this self-limiting condition. Antibiotics. Antibiotics are not the mainstay. And the correct answer is reassurance and eye bathing. Correct. Photophthalmia settles with reassurance, padding, eye bathing and analgesia. So, the right answer is option D. Reassurance and eye bathing. Question 77. A satellite nodule around a corneal ulcer suggests option A. Allergic reaction, option B. Bacterial infection, option C. Viral infection, option D. Fungal infection. The correct answer is option D, fungal infection. Let's go through the options. Allergic reaction. Satellite lesions are not typical of an allergic reaction. Bacterial infection. Bacterial ulcers are not defined by satellite nodules. Viral infection. Viral ulcers give dendritic patterns, not satellites. And the correct answer is fungal infection. Correct. Satellite nodules around a corneal ulcer suggest a fungal keratitis. So, the right answer is option D. Fungal infection. Question 78. Herbert pits on the cornea indicate. Option A, keratoconus. Option B, active trachoma. Option C, interstitial keratitis. Option D, pterygium. The correct answer is option B, active trachoma. Let's go through the options. Keratoconus. Herbert pits are not a feature of keratoconus. Interstitial keratitis. They are not a sign of interstitial keratitis. Pterygium. They are not a sign of pterygium. And the correct answer is active trachoma. Correct. Herbert pits, healed limbal follicles, indicate trachoma. So, the right answer is option B. Active trachoma. Question 79. Dacryocystodinostomy creates an opening into the option A, middle meatus. Option B, inferior meatus. Option C, superior meatus. Option D, maxillary sinus. The correct answer is option A, middle meatus. Let's go through the options. Inferior meatus. The inferior meatus receives the natural nasolacrimal duct, not the DCR opening. Superior meatus. The superior meatus is not the DCR site. Maxillary sinus. The maxillary sinus is not the target. And the correct answer is middle meatus. Correct. Dacryocystodinostomy drains the lacrimal sac into the nose at the middle meatus. So, the right answer is option A. Middle meatus. Question 80. A strawberry angioma on the forearm of a neonate is managed by option A, radiotherapy. Option B, immediate excision. Option C, masterly inactivity. Option D, sclerotherapy. The correct answer is option C, masterly inactivity. Let's go through the options. Radiotherapy. Radiotherapy is not needed for an infantile strawberry hemangioma. Immediate excision. Immediate excision is not first line. Sclerotherapy. Sclerotherapy is not the routine first step. And the correct answer is masterly inactivity. Correct. Most strawberry nevi involute spontaneously, so masterly inactivity, watchful waiting, is standard. So, the right answer is option C. Masterly inactivity. Question 81. Basal cell carcinoma of the skin, if small, may be treated by option A, chemotherapy. Option B, radiotherapy only. Option C, cryosurgery. Option D, observation. The correct answer is option C, cryosurgery. Let's go through the options. Chemotherapy. Chemotherapy is not first line for a small BCC. Radiotherapy only. Radiotherapy is one option but not the answer sought. Observation. Observation alone is inadequate for a proven BCC. And the correct answer is cryosurgery. Correct. A small basal cell carcinoma can be treated by cryosurgery or excision. So, the right answer is option C. Cryosurgery. Question 82. Regarding aneurysm, which statement is correct? Option A. An aneurysm may be mistaken for an abscess. Option B. It never pulsates. Option C. It is always malignant. Option D. It never ruptures. The correct answer is option A. An aneurysm may be mistaken for an abscess. Let's go through the options. It never pulsates. An aneurysm characteristically pulsates. It is always malignant. It is not always malignant. It never ruptures. It can rupture. And the correct answer is an aneurysm may be mistaken for an abscess. Correct. A pulsatile aneurysm can be mistaken for an abscess, so caution before incision is vital. So, the right answer is option A. An aneurysm may be mistaken for an abscess. Question 83. Acute lymphangitis characteristically. Option A. Can bypass the immediately draining lymph nodes. Option B. Always involves the first node. Option C. Never spreads. Option D. Is non-infective. The correct answer is option A. Can bypass the immediately draining lymph nodes. Let's go through the options. Always involves the first node. It does not always stop at the first node. Never spreads. It does spread. Is non-infective. It is an infective, usually streptococcal, process. And the correct answer is can bypass the immediately draining lymph nodes. Correct. Acute lymphangitis can spread past the first draining nodes to more proximal ones. So, the right answer is option A. Can bypass the immediately draining lymph nodes. Question 84. The specimen for biopsy of an ulcer should be taken from the option A. Center of the ulcer. Option B. Border of the ulcerated area. Option C. Surrounding normal skin. Option D. Base only. The correct answer is option B. Border of the ulcerated area. Let's go through the options. Center of the ulcer. The center is often necrotic and unrepresentative. Surrounding normal skin. Surrounding normal skin gives no diagnosis. Base only. The base alone is often necrotic. And the correct answer is border of the ulcerated area. Correct. A biopsy should be taken from the active edge, border, of the ulcer. So, the right answer is option B. Border of the ulcerated area. Question 85. Follicular carcinoma of the thyroid characteristically spreads by option A. Direct extension only. Option B. Lymphatics. Option C. Bloodstream. Option D. Transcoelomic route. The correct answer is option C. Bloodstream. Let's go through the options. Direct extension only. Direct extension is not the characteristic route. Lymphatics. Lymphatic spread typifies papillary, not follicular, carcinoma. Transcoelomic route. Transcoelomic spread is not relevant to thyroid cancer. And the correct answer is bloodstream. Correct. Follicular thyroid carcinoma spreads mainly by the bloodstream to bone and lung. So, the right answer is option C. Bloodstream. Question 86. Non-cooked meat most commonly transmits Option A. Tapeworm. Option B. Amoebiasis. Option C. Giardiasis. Option D. Hepatitis A. The correct answer is option A. Tapeworm. Let's go through the options. Amoebiasis. Amoebiasis spreads by fecal contaminated water, not meat. Giardiasis. Giardiasis spreads by contaminated water. Hepatitis A. Hepatitis A spreads by the fecal-oral route, classically shellfish water. And the correct answer is tapeworm. Correct. Undercooked meat transmits tapeworm, taenia. So, the right answer is option A. Tapeworm. Question 87. Maggots in a wound are treated with Option A. Saline only. Option B. Antibiotics. Option C. Steroids. Option D. Turpentine oil. The correct answer is option D. Turpentine oil. Let's go through the options. Saline only. Saline alone does not clear maggots. Antibiotics. Antibiotics do not remove maggots. Steroids. Steroids are irrelevant. And the correct answer is turpentine oil. Correct. Turpentine oil suffocates and helps remove wound maggots before cleaning. So, the right answer is option D. Turpentine oil. Question 88. Myiasis is caused by Option A. Ticks. Option B. Mosquitoes. Option C. Flies. Option D. Lice. The correct answer is option C. Flies. Let's go through the options. Ticks. Ticks do not cause myiasis. Mosquitoes. Mosquitoes do not cause myiasis. Lice. Lice do not cause myiasis. And the correct answer is flies. Correct. Myiasis is infestation by fly larvae, maggots. So, the right answer is option C. Flies. Question 89. Floors in an operating area contaminated with HIV are cleaned with Option A. 2% glutaraldehyde. Option B. Plain water. Option C. Alcohol. Option D. Soap only. The correct answer is option A. 2% glutaraldehyde. Let's go through the options. Plain water. Plain water does not disinfect. Alcohol. Alcohol evaporates too fast for floor decontamination. Soap only. Soap alone is inadequate. And the correct answer is 2% glutaraldehyde. Correct. HIV-contaminated floors are disinfected with a high-level agent such as 2% glutaraldehyde. So, the right answer is option A. 2% glutaraldehyde. Question 90. In cardiopulmonary resuscitation, the patient should be placed on A. Option A. Lateral position. Option B. Soft bed. Option C. Sitting position. Option D. Firm flat surface. The correct answer is option D. Firm flat surface. Let's go through the options. Lateral position. A lateral position is not used for chest compressions. Soft bed. A soft bed makes compressions ineffective. Sitting position. A sitting position is wrong for CPR. And the correct answer is firm flat surface. Correct. Effective CPR needs the patient supine on a firm, flat surface. So, the right answer is option D. Firm flat surface. Question 91. Insulin promotes. Option A. Muscle protein synthesis. Option B. Glycogenolysis. Option C. Lipolysis. Option D. Gluconeogenesis. The correct answer is option A. Muscle protein synthesis. Let's go through the options. Glycogenolysis. Insulin inhibits glycogenolysis. Lipolysis. Insulin inhibits lipolysis. Gluconeogenesis. Insulin inhibits gluconeogenesis. And the correct answer is muscle protein synthesis. Correct. Insulin is anabolic and promotes muscle protein synthesis and glucose uptake. So, the right answer is option A. Muscle protein synthesis. Question 92. Aldosterone excess characteristically causes. Option A. Suppression of renin activity. Option B. Increased renin activity. Option C. Hyperkalemia. Option D. Hyponatremia. The correct answer is option A. Suppression of renin activity. Let's go through the options. Increased renin activity. Renin is low, not increased, in primary excess. Hyperkalemia. It causes hypokalemia, not hyperkalemia. Hyponatremia. It causes sodium retention, not hyponatremia. And the correct answer is suppression of renin activity. Correct. Aldosterone excess, primary hyperaldosteronism, suppresses plasma renin. So, the right answer is option A. Suppression of renin activity. Question 93. The most common hormone secreted by a pituitary adenoma is. Option A. TSH. Option B. Growth hormone. Option C. ACTH. Option D. Prolactin. The correct answer is option D. Prolactin. Let's go through the options. TSH. TSH secreting adenomas are rare. Growth hormone. GH adenomas are common but not the most common. ACTH. ACT adenomas are less common than prolactinomas. And the correct answer is prolactin. Correct. Prolactinoma is the commonest hormone secreting pituitary adenoma. So, the right answer is option D. Prolactin. Question 94. Secondary stimulation of the parathyroid gland is caused by. Option A. Hypokalemia. Option B. Hypercalcemia. Option C. Hypocalcemia. Option D. Hyponatremia. The correct answer is option C. Hypocalcemia. Let's go through the options. Hypokalemia. Hypokalemia does not drive secondary hyperparathyroidism. Hypercalcemia. Hypercalcemia suppresses the parathyroids. Hyponatremia. Hyponatremia does not stimulate the parathyroids. And the correct answer is hypocalcemia. Correct. A low serum calcium, hypocalcemia, drives secondary parathyroid stimulation. So, the right answer is option C. Hypocalcemia. Question 95. The pharynx measures approximately. Option A. 12 to 14 centimeters. Option B. 5 centimeters. Option C. 20 centimeters. Option D. 25 centimeters. The correct answer is option A. 12 to 14 centimeters. Let's go through the options. 5 centimeters. 5 cm is far too short. 20 centimeters. 20 cm overstates it. 25 centimeters. 25 cm is the esophageal length, not the pharynx. And the correct answer is 12 to 14 centimeters. Correct, the pharynx is about 12 to 14 centimeters long. So, the right answer is option A. 12 to 14 centimeters. Question 96. The trachea measures approximately. Option A 10 to 11.5 centimeters. Option B 5 centimeters. Option C 15 centimeters. Option D 20 centimeters. The correct answer is option A 10 to 11.5 centimeters. Let's go through the options. 5 centimeters. 5 cm is too short. 15 centimeters. 15 cm overstates it. 20 centimeters. 20 cm is too long. And the correct answer is 10 to 11.5 centimeters. Correct, the adult trachea is about 10 to 11.5 centimeters long. So, the right answer is option A. 10 to 11.5 centimeters. Question 97. The normal thyroid gland weighs about. Option A 15 to 25 grams. Option B 5 grams. Option C 40 grams. Option D 60 grams. The correct answer is option A 15 to 25 grams. Let's go through the options. 5 grams. 5g is too light. 40 grams. 40g suggests goiter. 60 grams. 60g suggests marked enlargement. And the correct answer is 15 to 25 grams. Correct, the normal thyroid weighs about 15 to 25 g. So, the right answer is option A. 15 to 25 grams. Question 98. The esophagus pierces the diaphragm at which vertebral level? Option A T10. Option B E8. Option C T12. Option D L1. The correct answer is option A T10. Let's go through the options. T8. T8 is the caval opening. T12. T12 is the aortic hiatus. L1. L1 is below the diaphragm. And the correct answer is T10. Correct, the esophagus pierces the diaphragm at T10. So, the right answer is option A. T10. Question 99. Iron stores in the body are best assessed by. Option A serum iron. Option B serum ferritin. Option C total iron binding capacity. Option D hemoglobin. The correct answer is option B serum ferritin. Let's go through the options. Serum iron. Serum iron fluctuates and does not reflect stores well. Total iron binding capacity. TIP rises in deficiency but is less direct than ferritin. Hemoglobin. Hemoglobin falls late and is not a store marker. And the correct answer is serum ferritin. Correct, serum ferritin best reflects body iron stores. So, the right answer is option B. Serum ferritin. Question 100. Megaloblastic anemia due to B12 deficiency is confirmed by measuring. Option A serum iron. Option B serum methylmalonic acid. Option C serum calcium. Option D serum albumin. The correct answer is option B serum methylmalonic acid. Let's go through the options. Serum iron. Serum iron does not confirm B12 deficiency. Serum calcium. Serum calcium is unrelated. Serum albumin. Serum albumin is unrelated. And the correct answer is serum methylmalonic acid. Correct. Raised serum methylmalonic acid confirms B12 deficiency. So, the right answer is option B. Serum methylmalonic acid.